Mujumbe w'ebunge ya Burabu Omusiki Obadiah Barongo igaruro kuboria hojiase komiti ebunge igoro yogochenu kwene kibuna gokorere hobotiki buisaine kubwatikana negekorwa kiabetege kwene kiwa asinya gitari ya Kenyenya level 4 asomo ibori asilieta chali nyaboke abeteka gusiro bogima bwae chingakie hachiete koibora hase enyagitari yo kugwana ase hamagachi ebunge nene ho basolero igo Omusiki Obadiah haene kiriguna serikali gosokubwatira nankuraro we serikali nene hamone serikali chichi county bunenchereyemo yogokora ebikorwa ebyo.
Honorable Speaker, Article 43(1) of the Constitution safeguards the right to highest attainable standard of health, including reproductive health care for expectant women. Regrettably, cases of expectant mothers losing their lives or babies during delivery continue to be reported in the country. On Friday, 27th of February 2026, Mrs. Charity Nyaboke Nyasetia and her unborn fetus tragically died just before delivery at the Kenyenya Level 4 Hospital in Bomachoge Borabu constituency. The heartbreaking double loss is concerning given the claims that it may have resulted from delays or possible lapses in the provision of timely and appropriate emergency obstetric care. Honorable Speaker, while the delivery of health services is primarily a devolved function, the national government retains the responsibility for health policy, standards, and regulation of health professionals. Mrs. Nyasetia's death raised questions on enforcement of national standards for maternal health care, emergency referral systems, and regulatory oversight over health facilities and medical practitioners. The seemingly avoidable death calls for clarity on the effectiveness of implementation of national policies, standards, and regulatory mechanisms governing maternal health care in counties. Honorable Speaker, it is against this background that I request for a statement from the chairperson of the Departmental Committee on Health on the following. Number one, a report on the status of investigations, if any, undertaken by the relevant national health sector regulatory and oversight bodies into possible professional negligence or breach of national health care standards surrounding the death of Mrs. Charity Nyaboke Nyasetia, and disciplinary action, if any, taken against those found culpable of negligence. Number two, the measures by the national government through the Ministry of Health and relevant regulatory bodies like the Kenya Medical Practitioners and Dentists Council to ensure compliance with national standards for maternal and emergency obstetric care by health facilities in the country. Number three, the status of implementation of national policies and programs aimed at reducing preventable maternal and neonatal deaths, including strengthening emergency referral systems, ensuring availability of skilled personnel and access to essential maternal health commodities, particularly in Kisii County. And finally, the mechanisms available for collaboration between the national and county governments to ensure accountability and continuous improvement in maternal health care services.